Before the break, we were talking about crisis pregnancy centers. Amy, I want to let you in on this.
Yeah, I mean, so when we hear the words care, protection, and safety as it relates to the abortion debate, we have to be really careful and discerning about whose care, protection, and safety we're talking about. And increasingly, it's becoming clear that we are not talking about low-income women, especially young women of color. The pregnancy crisis centers, if we are talking about anti-abortion, right? So the desire to not encourage young women to get abortions, that's one thing. But when you are deceiving young women, when you're giving them misinformation, when you are not giving them the scientific facts, biological facts that can keep them safe and protect them physically, that is unconscionable. And so we're not just talking about a political debate here, we're talking about allowing people to have information to take care of themselves.
And there really is misleading information. I mean, I don't want to miss it. There really is misleading information, right, which is to say medically inaccurate information that is given about sort of the effects of abortion, which simply there simply is no research.
Which is different from not agreeing with abortion.
Yes.
It's very different. Yeah. So this level of deception is dangerous.
Yep. So this point I think is an important one. Right. So because I do think abortion is a relevant, important social, moral, political topic that deserves conversation in the public sphere.
That's right.
But there's the oddity of, on the one hand, Texas taking Medicaid reimbursements, not for abortion, right, but for primary health care that occurs at Planned Parenthoods, while at the same time using the abstinence-only education federal dollars to help support the crisis pregnancy clinics. The kind of unfairness in, like, these clinics actually get tax dollars.
Well, let's put things in perspective. I think that abortion clinics still outnumber by a wide margin crisis pregnancy.
They do not. No, not in Mississippi. They certainly do not. There's only one in all of Mississippi, whereas there are many, many crisis pregnancy centers. So throughout the South, actually, no, the crisis pregnancy centers are the way.
And you're arguing really that all the crisis pregnancy centers are deceiving. Look.
Yeah, yes, because I think people think the crisis pregnancy center means a place where I can go and potentially get an abortion.
But look. To say that abortion is the law of the land, I can admit that. That's a legal perspective. To say that abortion is objectively science-based, I reject that totally. That's an opinion. And I think
it's a medical procedure.
It's a medical procedure, like euthanasia could be a medical procedure as well. Yes, you kill a baby, it's dead. You kill an elderly person, it's dead. But we have to talk about the ethics and the morality about it. But I admit that it's the law of the land. But we live in a pluralistic society where we have to respect freedom of religion. And we have churches, we have people of faith that run clinics, that provides all sorts of services, and we have to protect their right not to go against their
Sure. But that is very different than giving tax. But that is very different than giving tax dollars to support one side while snatching it from the other.
We are giving tax dollars to Planned Parenthood, and they're deceiving. Let me tell you about the Hispanic community, how they go to Planned Parenthood thinking services, and they're immediately forced to have an abortion. And that happens every day.
No one is forced to have an abortion. That is simply not true. I'm not forced to have an abortion.
If I could, I think what's important about the protection is, states, California just did it, have had to step in because crisis pregnancy centers are so misleading and require them to be clear to women about the fact that they don't provide reproductive health services. And, women are at the center of this. They need to be able to make their decisions for themselves. We need to respect women in making those decisions, and that's not what the deceptive practices in crisis pregnancy centers do.
That is a very beautiful argument, but at the end, it's a strategy of intolerance. I believe.
It's not a strategy of intolerance. I actually think.
If I can finish, I know I'm the token different opinion on the show today. Let me explain what I'm trying to say.
Okay.
I believe in democracy. I'm against imposing religious dogma. I believe I'm against imposing secular dogma. And to tell a center that you have to talk about abortion when you're providing services to women, that's...
But I will say, if you receive federal dollars, the idea that you actually give medically inaccurate. So let me just say, in the state of North Carolina, so for example, in the state of North Carolina, in our sex ed for students, you actually have to give medically inaccurate information. And I'll give you the example of what it is. People who teach it are told that they have to tell students that having an abortion affects your ability for later fertility, which is simply not true. And yet you have to do this. So in fact, we do have the government stepping in and stepping in on only one side. I want to say thank you to Nancy Northrup and to Alfonso Aguilar, Amy Meredith Cox, and to Kenji Yoshino.